Okay. Welcome, welcome. Thank you for joining me. I've got my brother on here today, Robin Satcher.
How you
He,
doing this morning?
good, good. So let me introduce you just briefly. Um, this brother is younger than I am. He's actually the youngest in our family, and he got his undergraduate degree in chemistry from Howard University, and he also has a master's degree in clinical nutrition from Howard University. And the reason why I'm doing this talk series is because I want to uh, get experts in different fields to talk about what people of color or people that are melanated, what they can do to avoid or prevent getting the coronavirus. And also, I want to talk about if they do get it, what they should do. And finally, in the media, they're talking about the health disparities and how many Black people are dying. And I knew that when I came up with this idea, like at the beginning of March, I knew that that was going to happen because of the health disparities that already exist. So, welcome, Robin. And how does your degree in nutrition differ from a registered dietitian, first of all?
Okay, so my degree specifically in nutrition is in community nutrition and food science. Um, and so I'm more community based, where a registered dietitian, you do your internship in a hospital. And a lot of time you're dealing with a lot of the same type of nutritional cases like total parental nutrition and um, other things regarding to that. I prefer the community nutrition side because it's more hands-on and I get to talk with, I feel like, more variety of people
Okay.
and giving them more hands-on advice.
So you're kind of like you're on the community level, like on the ground level, kind of like uh, addressing kind of like the social determinants of health, right?
Yes, exactly. And especially with the food science and able to advise people on proper ways to think about food.
Can you tell me a little bit about your research during your studies for your master's degree in nutrition?
Yes, so it was dealing with type 2 diabetes. So the name of my research was risk factors for type 2 diabetes in African American adolescents. So it was a risk study. I I went through Howard University Hospital. I helped them out with several studies over there, but I was able to use some of the data from one of the studies that I helped them with. So local use from Washington, D.C., all adolescents, and I broke the group in half. And I've just made a correlation between their risk for type 2 diabetes. All the participants had a family history of diabetes, meaning to have a family history of diabetes, you only have to have one relative who has diabetes. You don't have to have a slew of relatives that suffer from that malignancy. All you have to do is have one relative to have a family history. So all of my participants had a family history of type 2 diabetes. I made a correlation between sedentary behavior and waist circumference. And I was actually showing a very positive correlation between the two, especially when you're talking about type 2 diabetes in the African American community. One of the main issues is going to be overweight and obesity, um, high blood pressure, um, various things like that, sedentary behavior. So I made that correlation and I was able to show a lot of positive results between those two. It seems kind of simple, but it is very crucial when it comes down factually between that correlation between waist circumference and sedentary behavior.
So that's how big a person's waist is, just going by that number. So if a person takes a tape measure and puts
Yes,
it around their
that's
waist,
I found out to be most effective. When I first started my research, I was doing some waist to height measurements, and then actually doing more research, I found out it's a better indicator if you just focus on specific waist circumference. And then that's something that someone can just do at home by themselves.
And where can they look up the normal number for, because they probably can look up a normal number, right? Online.
Yes, you can. Yes, if you're online, you can maybe Google something about BMI, which is your body mass index, or your normal waist to height. They'll use height also on the internet, but you can see what values where you should be and if you fall above that or below that.
Yeah, and I know in functional medicine we use like waist circumference, and we also use, I think, waist to hip ratio.
Yes, uh-huh.
Hmm.
And that shows you a good indicator of adiposity where you're carrying that weight. In general, you shouldn't be carrying that weight around your waist and your stomach area because that really will cause a lot of other um, malignant factors.
Yeah, that increases your risk of just cardiometabolic disease in general.
Hmm.
And it's good that we're talking about this. I'm going to ask you another question about your research, but I wanted to bring up that doctors in New York are saying that over 60% of the people that are dying are obese or have some of the cardiometabolic risk factors that we were just talking about, like diabetes.
Yes, because of course in the African American community we have high rates of what they call syndrome X or metabolic syndrome, where it's a combination of high blood fats along with obesity, along with say diabetes
Hmm.
and high cholesterol levels as well.
Hmm.
So that cluster of those factors is called metabolic syndrome. And
Hmm.
since a lot of African Americans suffer from that, that means our bodies are compromised in a certain way so that when we do maybe possibly contract something like the COVID-19 or coronavirus, our body has to do a little bit more work to try to overcome that invasion.
Hmm. So probably the best thing is for us to be proactive and to try to decrease our risk even before we're exposed to it, right?
Yes, it's basically like what we should have been already doing is practicing a healthy lifestyle, healthy food choices, get your exercise, thinking about your mental health. Yeah.
Yeah, and bringing up, well, I want to go back to your research because I remember you did some research on HIV or in the HIV arena too.
Yes, I did. I did an internship while in grad school for USAID, and I worked in the nutrition department for Southern Africa. So that's when they sent me overseas. That was over 10 years ago. They sent me to Ghana, but I worked on a lot of projects dealing with Mozambique, South Africa, Nigeria, and but I wrapped up a nutrition program in Ghana. But I was working at the time on 5 different projects. They had me on 5 different projects, and one of the projects was HIV and AIDS nutrition. So I was actually able to learn a lot about that. Attended a lot of very informative meetings in DC, and that's something I still try to study on the side at this particular time.
Hmm. And I know that you're teaching kids in school right now too, right? Or is it a
Yeah, for the majority right now, I'm teaching mostly adults, uh,
okay, okay.
adult education within Richmond Public Schools, Richmond, Virginia.
So,
But I go back and forth. So I've done a lot of middle school things with the kids and a lot of math and science. And yeah, I kind of go back and forth.
okay, okay. So I know you're in touch with some of the social determinants of health and the difficulties that people of color and melanated people have in terms of, mental health, and then also probably just generational stress, like from slavery just being coming down through the generations. Um, And just, you know, in functional medicine, what we look at is like the central node of the functional medicine matrix is the mental, emotional, spiritual. And what I tell my team at my part-time is that, you know, if that center node is kind of out of control and not being addressed, that people are not able to make changes in their lifestyle. What are your observations regarding that? Because I know you're on the ground. You know, you're seeing like some of the root issues that we have going on in our community.
Hmm. And that was something that I believe when we were speaking the other day that we touched on is with food choices and lifestyle choices. If you're in a state where your living situation isn't quite the best, or your socioeconomic situation isn't quite the best, when it comes down to food choices, a lot of time, and I've heard you ask it a lot too, do you basically, are you eating to live, or do you live to eat? Or are you eating for celebration mostly, or are you eating for just wise choices with taking in the proper energy to live? It's making that distinction. But if you come from a place where you may be suffering from some sort of depression, or like you say, you think about the history of African Americans in this country, we still have um, that stigma, that chip on our shoulder, where we may not make the best choices based on factors that cause depression, or not keeping our mental health up to par where it should be, speaking to people about exactly how you feel, which is very difficult, especially mental health within the African American community. It's almost like a stigma. African Americans don't really like going to a psychiatrist or a a person to talk to about things like that. So you might almost say self-medicate, where your food choices are horrible, but for some reason you think you feel better when your body is struggling at the same time.
Yeah, I like the terminology self-medicate because that's actually I see that not only in our community but other communities of color because kind of like you know we're um, socially and economically depressed in this country, um, and it's not in totality, but we have larger numbers.
Yes.
Uh, yeah. And so, yeah, I do talk about the are you eating for celebration? Are you eating to fuel your body? Because fueling it properly is really important. So I
And
can
I
see,
still,
go ahead.
I still think a lot about and try to do some research on the stroke belt in the United States. The stroke belt comprises most of the states in the southeastern United States, with the exception of, I believe, Florida. But that may be changing currently. But you're talking about North Carolina, South Carolina, Georgia, Alabama, Mississippi, even Tennessee, Ohio, as far as Ohio also. So the stroke belt means, just like it says, a high instance of people having strokes or heart attacks, or um, higher rates of diabetes. And once again, southeastern United States, which is mostly African American, and this problem is persistent and it's been around for a while. And they also call an element of it the stroke buckle, where coastal states are having higher rates of these diseases, and scientists still can't figure out quite why.
Hmm. I can guess some reasons why. And I can guess a reason why Florida may have a lower incidence because they have more sunshine. And we see just like an epidemic of vitamin D deficiency on the East Coast in general.
Hmm.
And vitamin D acts more like a hormone and it controls a lot of factors in the body that have to do with just general health. Um,
Exactly.
yeah. But one of the things that I thought of too when you were talking was there's some research out that's new research, but they found that the coronavirus um, utilizes the ACE2 receptor, the angiotensin enzyme
Okay.
that's on the surface of the cell. It's the type 2 receptor, and the virus utilizes that to get inside of the cell. And what the reason why I thought about it is because I was reading a paper yesterday when you referenced stroke, and they were talking about how this enzyme, like if you have uh, genetic single nucleotide polymorphism for that enzyme, like if you have a weakness in your production of that enzyme, that increases your risk for stroke. I was trying to find, what I'm trying to find is if there's any connection with that enzyme receptor in the African American genetics that come from Africa. But that's, I've got to do a lot of digging. It's not easy to find.
Yeah.
Yeah, but when you made that statement about the stroke belt, that makes me wonder, if that's contributing to our increased incidence of death from the coronavirus. I do know that many, because we have more hypertension and more diabetes, and because those ACE inhibitor medications like enalapril, captopril, because those are used in many people that have hypertension, and many people, it's like part of the cocktail when people have diabetes. They usually put them on metformin, an ACE inhibitor, and a cholesterol medicine. And those medicines cause deficiencies that I know you're familiar with,
Uh-huh.
like in B vitamins and in minerals. And that increases your risk in itself as well, just being on those medications. Yeah.
And another point is with the coronavirus, and once African Americans are now starting to see how we're disparaged within all the percentage of confirmed cases and confirmed deaths, that doesn't mean African Americans are more susceptible to the coronavirus. It just so happens that when we do get it, like we were saying before, your body, if it's already dealing with a lot of things, it's going to have to continue to deal with those things and deal with having a foreign virus in your body doing detriment. But it's not like we're more
Yeah,
susceptible.
I wasn't trying to say that. Yeah, thank you for correcting that. I don't think we're more genetically susceptible, but it's our lifestyle factors that increase our risk of dying from the virus.
And
Mhm.
just getting back to the food part, especially nowadays with you're not able to go out to restaurants or whatnot, curbside pickup or order from a place. But the places where it's not really affected are all the drive-through places. So when you talk about your McDonald's, your Burger King, your fried chicken places, when I do my walking every day and I walk past these drive-throughs, there's always a line of probably like 20 cars just waiting to make their orders at these fast food places. And fast food is horrible overall, but in this particular time, we should not be eating more of the fake food.
Yeah, thank you for saying that because and that's part of the issues of melanated people and people of color is that we tend to be higher utilizers of the fast foods anyways. And then when the leader of the country got up a few weeks ago and said that he was happy and named some of the fast food restaurants that would be open, I just cringed because I said, no, no, we need to be going to the grocery store and buying. And at that time too, the fruits and vegetables, when you go in the store, that's what's left on the shelves, actually, the fresh food. People are buying the food in the middle of the store
Uh-huh.
because I guess they want it to last for a long time. But
So
you
like
know,
TV dinner type, frozen packaged,
packaged food. Yeah.
yeah, full of additives and preservatives, and they'll try to enrich it with certain vitamins or fortify with certain minerals. But you got to go straight to the source. You want to eat natural foods, especially in this time where everybody's at home. You have more time to work on recipes and more time to think about what you're going to eat for that day.
So go into that more because people are looking for specific, nutrition recommendations, hydration, what would you tell people right now for optimizing their immune system and to avoid getting sick?
I would say general lifestyle changes or modifications like eating more natural. And like you said, hydration. Hydration is key. Taking supplements. I like taking, I have just one really good multivitamin, and then I also have some other supplements that utilize medicinal mushrooms. I really like reishi, chaga, turkey tail. Those elements in those mushrooms are really good for your immune system. And just the fresh fruits and vegetables. You don't have to make it too complex because then you get those natural vitamins and minerals from those fresh fruits and vegetables. Um, Frozen works with vegetables a lot of time if they're flash frozen, and even some fruits like berries. Because something I think about is where people might live in a food desert where you don't really live close to a grocery store, so it takes a little bit more energy to get to the grocery store. You may only go to the grocery store once or twice a week. So you want to get something that's not just going to sit around and spoil in your refrigerator. You buy like some vegetables and it just stays in the bottom crisper, and then you forget about it, and then it's spoiled. So
Mhm.
that's why a good option would be to try to invest in some frozen vegetables. It's not bad for you. Um, I think frozen vegetables are better than canned. Um,
Yes, less sodium and less exposure to the heavy metals and plastics they use in the inside of the cans.
exactly. And what I try to tell a lot of people nowadays is when it comes to cooking on a daily basis, be creative. Just be creative. Come up with different recipes. If you have kids around your house, incorporate them to do a certain task in a recipe. Have them do some mixing. Have them do some other type of task, so that everybody gets involved and
Yeah, the
make
kids
it interesting. Be creative.
Yeah, the kids can even, depending on their age, like if you have older kids, you can tell them what you have in the fridge or what you have in the pantry and tell them to find a dish online to make, right?
Come up with a recipe. Yep,
Yeah. And when you're talking about frozen foods, a lot of times flash frozen is cheaper than the fresh, is what I know.
exactly. Yes. Uh-huh. You can usually get a bag of corn or okra or green beans, or usually they're $1 and some change for those bags.
Mhm. And I like to tell my patients to get things that are not no sauces, no sodium if possible.
Yeah, reduce that sodium level. Of course, everyone still ingests too much sodium on a daily basis. So
Mm-hmm. And what can you say about people will be asking, or this is what they frequently ask me is like, well, can I eat meat? Because you didn't mention any proteins.
that's true because I feel like we overdo meat a lot. Uh, it should only comprise, maybe about 20% of what we eat on a daily basis. You want to go for variety. Meat shouldn't be the main course. It should just be a part of um, your table of healthy food. Uh, you don't want to just gorge on eating a steak or a pork chop every day. You go
Mhm.
to the grocery store and you can buy like a pack of pork chops where they give you like 10 in a pack for some really cheap price. And
Mhm.
when I used to take people grocery shopping, they would see that and they're, oh, it's so cheap. And I'm like, no, you don't want to do that. It's like,
Mhm.
especially if someone lives by themselves and they'll sit around and eat that solely for a week.
Uh-huh.
No vegetables, no maybe some bread, and then yeah,
Yeah, and
and
pork is
soda.
probably pork for people of color is probably one of the worst choices that they could make in
Hmm.
terms of meats. I tell people it's better to buy like small portions um, that have been grass fed, wild caught, free range as much as possible, and not fed hormones.
Yeah,
Um,
and there are a lot of options out there for things like that. You don't have to spend an arm and a leg uh, trying to pay for those things. There's so many varieties out there that are doing something just to improve the quality of how that animal was raised.
and
And then
now,
the preparation is key too, because if you buy
Mhm,
certain types of red meat, and a lot of people are inclined to fry it,
mhm.
uh, all day and all night. But baking and boiling are obviously better choices if you're doing the meat thing like that. But you just want to limit your intake with certain heavy meats like that, and think about your preparation choices.
Yeah, at the VA and with my private patients, I tell people that it should be less than a quarter of their plate that is meat, like animal meat.
Hmm.
You know, if they're, what I was going to say too is there are a lot of choices now with plant-based protein.
Oh yeah, yeah,
Like I love the bean pastas, and now they even have like these kind of rice pasta made out of bean.
yeah. I've seen that. Yeah,
hmm And then they have like those. I'm not a big fan of the fake meats.
I'm not either. I tried some the other week, basically like the Impossible Burger type stuff,
Mhm.
and interesting texture, interesting flavor. Um, I'm not a big burger person anyway, uh,
Yeah, me either. But I
but
think too, you have to be careful reading the labels, and that I think a lot of people that are vegetarian eat too much soy. And
yeah,
if
you got all those binders that you really have to be careful with.
Yeah, and if the soy is GMO soy, that's not good for us either. So, and that can affect our hormones, make men's voices go up.
Yeah, that's because soy contains a type of uh, estrogen.
Estrogens. Yeah, yeah. So, what about water intake?
I would say um, to keep up with your water intake, buy containers if you can of gallon water or bottled water. A lot of bottled water is very cheap now because it's very easy to keep up with your intake to know how much you drank during the day if you have a container like that. Otherwise, if you don't have a problem with drinking tap water, you can use a pitcher in your refrigerator and know the volume of your pitcher in the refrigerator. And then once it's gone, you know how much you've drank.
Yeah, and I encourage people to get the filters because, like those pitchers you're talking about, you can get those filters in the grocery store and they're kind of inexpensive. I've actually seen those filters in Aldi. So, you know, if you
Okay.
hunt Aldi, you can find some of these things. hmm
Yeah.
Aldi and Trader Joe's also have the organic foods that are reasonable.
Yeah, you're right.
hmm So, you talked about the meat. We talked about, oh, when I mentioned the meat or the protein, the rest of the plate should be vegetables, right?
Yes. Uh-huh.
Yeah, and
Of course, we don't get enough vegetables and fruits per day. Um, as a nutritionist, we recommend, up to 6 to 8 portions per day. That's kind of hard to do sometimes, especially when you have an active lifestyle, as opposed to now where everybody's hunkered down. But that can be difficult to do. Um,
Yeah, actually, one of the researchers in my field in functional medicine has recommended 9 to 12 servings of fruits and vegetables a day because she found in research that when people have autoimmune disease, that helps to heal them.
Yeah.
without even taking supplements. I would say probably people will still need supplements of vitamin C and D, maybe some of the antioxidants, but um, and that's not because you're not eating the volume of food when you eat 9 to 12 servings, but it's because the fruits and vegetables don't have as many nutrients as they used to.
Hmm.
So you have to kind of make it up. Um, so yeah, and eating the rainbow is important, like different colors, right?
Yeah. Because
Hmm.
all those color compounds contain a lot of antioxidants. So you want to go for the rainbow. You want to eat things that are orange, green, yellow, purple.
So another thing that I tend to address with people and they never bring up, but you know that they're doing it at home, is like eating piles of rice, bread, and macaroni and cheese is big with African
Yeah.
Americans. Yeah,
Pasta.
what would you say about that?
It's hard because foods like that, especially when you talk about mac and cheese and rice, basic comfort food, um, I've always found it hard to give people certain types of advice dealing with their comfort food because a lot of people just get offended. Some of them will listen to you, others just don't want to talk about it. Um, but it all comes down to if you could just limit the amount that you eat. Um, you don't have to eat the heavy mac and cheese every day. Um, I couldn't do that, and I love mac and cheese, but especially if you make the mac and cheese a Southern style, where a lot of butter, and then your milk and eggs and tons of cheese. But it's good, but you can't eat that all the time.
Yeah, and what I point out to people that are obese and who are overweight and who have diabetes that they may not recognize is that that's actually pushing up their blood sugar, but they don't realize it.
Yes, because when those carbs break down, it's just going carbohydrates or sugar. So you're just going to spike your insulin levels, your blood sugar levels.
Hmm. Hmm.
And especially with the coronavirus, where people with diabetes, where we talk about insulin resistance. I don't like to call it insulin resistant, but just more of the floating glucose and sugars in our bloodstream, where our bodies can't, it's overworked and our bodies can't handle it to get into the cells for energy because it's already overloaded. So that's why you have all that, your fasting sugar levels and your glucose are very high. So once again, I say compound that with a detrimental virus that gets in your body, and
Yeah, because we know medically when we're trying to manage people's infections that infections of any kind just go crazy in your body when you have extra sugar floating around. So eating those foods are going to cause you to have extra sugar floating around when it's not necessary. Um, and when your body doesn't, that's not required food because a lot of people are kind of brainwashed that you're supposed to have a quarter of your plate be a starch, right?
yes, um, that's a general recommendation, and a lot of people go crazy with that. Um, yeah,
Yeah, and I would say instead of those processed starches to put like complex starches on your plate, like root vegetables, right?
hmm exactly, and that's why I don't know. You really haven't seen much about food guidelines in recent times. Back in the day, we had
The
the
food
food
pyramid
pyramid, and we found out that
was ludicrous.
people weren't didn't know how to analyze that, and then we went to that modified simple version where it was just four squares. Uh, it's supposed to be a plate, and they just had like general headings in each square, and they saw that didn't work. And then, but it's always good as far as food guidelines. If you look at the Mediterranean model, if you look at their structure, um, you can see a lot better where highlight is on fresh fruits and vegetables, fish, um,
Beans.
beans. uh, oils.
Whole grains. Hmm. Yeah. So, everyone in our immediate family loves good food and cooking, and you're an excellent cook.
Oh, thanks.
What are some of the highlights, over the recent days in your household while we're doing this shelter in place? I know you're in Virginia.
Yeah.
Hmm.
And yeah, I try to be creative, just like I was saying before. So this week, let's see. Well, yesterday I made a veggie stew, or soup, kind of per se.
Hmm.
Curry, coconut milk tofu, spinach, beans, tomatoes, a little bit of tomatoes, and
Mm.
a lot of herbs and spices, and put it in the slow cooker and let it go all day.
Wow. Wow.
And it turned out to come out to be quite good.
That sounds
Uh,
fantastic. I love
make,
curry.
yeah, I made corn chowder earlier this week, um, and I baked it, and I had found this very healthy version for corn chowder, just using only natural ingredients, and it turned out to be very good.
Hmm. I never heard of that. Baked.
Yep.
Hmm.
Hmm.
Wow.
I usually do fish 3 times a week, some sort of fish. Um, let's see.
And are you buying fresh or frozen fish?
Yeah, I do fresh because usually about every other day I go to the grocery store, just because, of course, like everybody, I get cooped up inside and I just want to take a walk. And I go to the grocery store and usually spend 5 minutes in the store, in and out.
Mm-hmm.
Yeah, go look at the seafood section, see what looks good and fresh. I'll just get something and, get some vegetables, create a recipe.
And you live in downtown Richmond, so you guys don't have
Yeah,
you don't have crowds in the store, right?
no, no. And we have a new Whole
Empty.
Foods in our neighborhood.
Mm-hmm.
So I like to go there in the morning. It's quiet, not many people.
Okay.
Like I said, I'm in and out, and then
Okay.
that's where you got to do it.
Yeah, where I am, we don't want to encourage people, mainly on the East Coast, to be going to the store more than like once a week or
Yeah,
once
yeah,
every couple of weeks,
yeah.
is there increasing the risk of encountering the virus. But yeah, so I've been doing like pastas and soups at night for dinner. Those are mostly vegan.
And then for the pasta that you use, what type are you?
Yeah, so yesterday I had a chickpea pasta. Um, and I got this cool dandelion miso. There's a company called South River Miso, and they make these really interesting misos. And the dandelion is only available in the spring.
Wow.
And this is the first time I've gotten it. I had it shipped to my house, but I use that kind of in the sauce for the pasta, and I put green bean, green peas from the freezer, and I chopped up like a half a zucchini that I had left over, and put some herbs in there, some fresh herbs, like I had some parsley
Mm.
that I needed to use up. So yeah, and olive oil. Yep, and the pasta was cool. It was kind of that I forget the name of it. It's not a corkscrew. It's like a pasta that's kind of rolled this way, but it's long.
Okay. Okay.
Yeah, and I got it from a big chain grocery store here, and we have a lot of Italians here. So
Okay.
I think because I was like, wow, I can't believe they have this, this style of pasta in chickpea pasta. Because usually it's like elbow macaroni or shells or penne pasta or spaghetti. I like the pasta made out of chickpeas or black beans, or there's actually pasta made out of green beans too.
Wow.
They have edamame, but I don't tend to eat much of the edamame pasta. So yeah,
Okay.
yeah. But I love that dandelion miso. It's
Wow.
very interesting. Yeah. And I think it has leeks in it too. Dandelion leeks. And that onion family like has so many good things that help our immunity right now. The quercetin is in the onion family, right?
Yes, it is. Uh-huh.
And quercetins, they're saying it's one of the ionophores for zinc.
Hmm.
Um, so it helps the zinc to get inside the cell.
Okay.
So
And
it
I
helps.
believe that's also good for like the lining of your blood vessels as well.
Yes, you're right. For cardiovascular disease, it's
Hmm.
like an anti-inflammatory, right, for
Yeah.
your blood vessels.
I eat some form of raw garlic every day.
Hmm.
Um, most of the time, onions, whatever I cook, I'm usually putting onions in it as well. It's from
Yeah,
the allium family. So yeah, onions, garlic. Um, yeah,
leeks and what's the
yeah,
shallots,
shallots.
all different kinds of onions, right?
Mhm. Yeah,
Yeah, I try to eat something from that family every day too, because it's just good for our overall health, right? So many
yeah.
different applications.
And if you
So,
don't like the garlic, you can always buy those pills, odorless,
mm,
odorless garlic.
hmm So, one of my friends that I interviewed, she's a pediatrics doctor, she suggested some activities to keep kids occupied while they're shut in. And you mentioned things the family can do around food.
Hmm.
Did you have any other ideas about that? Like, what if people have small children? How can they help with food preparation?
How small are you talking?
Like probably 4 or 5 years old would probably be the oldest or the youngest that you would have in the kitchen, right?
Yeah, yeah. Um, Depends on what you're making. You could find something simple that they could actually help with. Something else that you could do, depending on the age, is um, you can go buy like flour or pizza dough or something like that,
Hmm.
and let them make the pizza dough. You can make it a little bit denser with less liquid, almost into almost like a play-doh, and kids can actually play with the dough.
Okay, that sounds
You,
like a great idea.
you can put some flour down on the counter. It could get a little messy, but it's still easy to clean up. So
And the kids are more likely to eat it, right, if they make it?
yeah, especially if you're doing something, say with like some dough, like of course the kid would love to make pizza.
Hmm. And I've heard too that they're more likely to eat vegetables, like if they're involved with making it,
Yeah.
right?
Uh-huh.
And actually, adults might eat more vegetables, like, right?
If you incorporate it, or
Yeah.
they have some cooks who hide the vegetables within maybe a sauce or something like that, so the person doesn't know that they're actually eating cauliflower or you know broccoli or another healthy vegetable, or incorporate it in something where you don't really you're not eating it whole. So
Yeah, actually, me and my friend, this pediatrician, we've cooked together sometimes, and like you can do that with pesto, like
yeah.
make a sauce with like green beans or with cilantro or um, parsley or basil or
Mhm.
like whatever you have, kale.
Yeah.
Is like Trader Joe's has the kale pasta. I mean the kale pesto.
Okay.
It's a sauce that you can use on just about anything, and nobody will be able to tell that it's kale. Yeah,
You still get your nutrients, and
yeah, yeah. So, well, I thank you for talking to me. And did you have any other recommendations for people regarding, like, say, if they get sick with the coronavirus, what can they do from a nutrition aspect to increase their risk of survival?
so if they actually got it, I would say as far as foods, mostly liquids. You want to do soups. You want to do light broth, um, especially if you can get a hold of like some beef bone broth, or you can go to stores now and
Oh,
buy containers.
yeah.
And then, of course, just increase your hydration. Um, and if you get it, you're probably not gonna really feel like eating anything heavy anyway. So that's why if you, those clear broths, clarified broths that contain a lot of nutrients
Mm-hmm.
um, and fluids.
Mm-hmm. Mm-hmm. Yeah, that's great advice. That's what I tell my patients. And I don't know why, like many African Americans and people of color, they want to have people bring them like barbecue and steaks and stuff,
Yeah, the heavy things.
and that's really a stress on your system, right?
Yeah, yeah. Your body has to spend a lot of time breaking those foods down,
Mm-hmm.
using a lot of crucial enzymes in our bodies to break those foods down.
Mm-hmm.
So it's basically like you got to give your body a break.
And what's your opinion of dairy when you have a fever?
I would say no. I would tend to stay away from those mucus producing products, especially if you're going through um, any illness like that.
And what about genetically modified foods? Like I'm thinking of gluten and corn that are GMO.
Yeah, if you read labels, you can just try to stay away from those things as much as possible. A lot of products will have on the back a disclaimer saying that this is processed with genetically modified elements, or it'll be a sticker on the back that says no genetically modified elements in this food. So
Hmm.
usually, if you read the back of the product, you can get that information.
And instead of those wheat noodles and soup, I tell people to do like just drop a little rice in there if you start getting more hungry, and then just increase it as you tolerate it.
Yeah, that's a really good idea.
Mhm. And what fruits are things that people can easily digest? Like I'm thinking of
Um,
certain ones. Like,
Apples are really good
hmm.
uh,
Hmm.
because apple is a fruit where it's unique because it can be combined with a lot of other things
Hmm.
without any adverse reaction in your body. Your body's not going to create any mucus or anything like that.
Okay.
I try to study a lot of food combinations, and it's a lot of things that we really shouldn't eat together because it
Mhm.
comes down to creating a lot of mucus in our gut. Apples are great. Berries are good.
What
Um,
kind of combinations do I love that food combination
oh yeah,
suggestion. Like what do you want to avoid? Like I know myself like dairy and meat and sugar, right? Like those
yes.
things you don't want to combine, right?
Mhm. And bread and say which is a carbohydrate, a simple carbohydrate with and it sounds bizarre. And I've been studying it. I have a couple of books that I reference a lot, but bread and proteins, carb and protein. So like a sandwich,
Mm-hmm.
you know, sandwiches do create a lot of mucus inside of you.
Mm-hmm.
Something like macaroni and cheese,
Mm-hmm.
carbohydrate and protein, it creates a lot of mucus inside of you.
Mm-hmm. Mm-hmm.
Um,
And that mucus hangs around for weeks,
yeah,
right?
and then you'll be having all kind of symptoms and you don't know why. Um,
Yeah, like people with asthma, I try to get them to stop doing dairy. Hmm. Yeah, because that mucus, and that's a factor with this coronavirus. Like the lungs fill up with a proteinaceous mucus,
hmm,
and that's why people can't breathe.
okay, and that is that the key with the ventilators? It helps expel that.
Well, the interesting thing with the ventilators that's happening now is that the ventilator doesn't save everybody. It's kind of scary, but the ventilator is not the solution every single time because when your lungs are full of that liquid, um, and they have to increase the pressure that the ventilator is delivering, a lot of times it's a fine line between increasing all that pressure to try to get the oxygen across the liquid barrier
Mhm.
or the pressure causing damage and inflammation to the lungs.
Wow.
So the past week or so, there's been information coming out with doctors describing that the patients are like turning blue even when they're on the ventilator.
Wow.
Yeah, so we have to do things to improve our health to avoid having to go on the ventilator. That's why I'm interviewing people like you, because like we need real recommendations. And the hydration is so important if you get sick with this particular virus. So I'm glad you mentioned that. Bone broth and just drinking liquids, water, 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 not like juice and sugar, you
Hmm.
know. You can have some of that, but you don't want to drink so much juice. Like more than a serving of juice a day is going to be feeding the virus, like feeding, it's an infection, so you're activating it with sugar. hmm
Yeah.
yeah, but bone broth is one of the best things because it's got minerals, it's got everything you need in there, and people can survive on water for a number of days actually, um, without starving.
Uh,
So for weeks. So, you
yeah. And
know.
as far as those broths, they're very easy to make at home anyway.
hmm
Um,
hmm
if you save the bones from whatever beef product you use, or chicken, a chicken carcass that
Or fish.
most of the meat is off of. If some meat's on there, it's fine.
hmm
Add it to water with some vegetables. Let it simmer. But yeah, fish.
And you can even, not with fish, but I mean, with fish, it's like white fish bones that have to be fresh. But with the beef and the chicken, you could even save the bones after you already cooked it and ate it, right? Like you ate the meat off the bones. I've done
Yeah.
that before.
Hmm.
You might need more of the bones, but you can put that in water and just cook it all day,
Hmm.
and it leaches out the minerals if you put a little acid in the water, right? Like
Yeah,
lemon or,
a little bit. Hmm.
mhm, mhm,
And then with the bones, you can always store them in the freezer as well,
mhm,
until you get the amount that you want to make a nice little pot.
mhm, mhm. That's super super informative information. I'm so glad that you were able to come on here.
No, thanks for having me.
Yeah, and I've held you long enough. This is one of the longer ones, but I appreciate your time.
No problem. No problem.